Hey, folks, welcome back to the show. We have a great episode for you today. My guest, she's just a really special individual. And I think that you will enjoy her content and her message as much as I did. Her name is Andrea Nakayama, and she speaks to the piece of solving for healthcare issues that is the softer side. Right. So we're not necessarily talking about a specific supplement or a practice or whatever the case may be, but we're really wanting to go deep into a person and what is it about us and how we carry ourselves through our days that might have a very powerful impact on how we heal, how we feel illness, and the whole nine yards. So that's a quick little insight into this episode. In the meantime, I want to invite you guys, of course, to sign up for the newsletter at natnidham.com because that's how we get to stay in touch. I give you a quick synopsis of episodes there and also my favorite biohacks every week. Every once in a while, we do a dedicated newsletter about a specific topic that we feel would be of value to the community. And finally, if you're one of those people that's really big into peptides, you can sign up specifically for the peptide newsletter, which is a separate entity from the general newsletter. So we've got lots going on there. Head on over to natnidham.com. Top of the screen, there's a red bar with sign up for the newsletter, and that's where you'll be able to do it all. Okay. And beyond that, if you get value from this episode, you know what to do. Hit forward to your friends, to your networks, anybody else you think would get benefit from it as well. And if you're feeling inspired today, please make sure that you leave us a review on whatever platform you're listening to this podcast on, because this is how we reach more people. Let's talk about the episode a little bit. How tired are we all about chasing quick fixes for our health issues? So especially the persistent ones, the ones that you just can't seem to get to the bottom of. And so in this episode of the Longevity Podcast, I get to talk with Andrea Nakayama to explore the power of a more holistic, personalized approach to health and wellness. We discuss the importance of looking beyond symptoms to understand the full context of a person's health journey, why conventional medicine often really falls a bit short in addressing chronic health issues, and how building a strong health foundation before pursuing advanced treatments might actually be the key to getting the results you're after. We even discussed things like how dance, poetry, art, all of these can play a crucial role in our well-being, depending on whether they resonate for you, of course, but things that take us outside of our regular day. Now, Andrea Nakayama is an internationally known functional medicine nutritionist, educator, speaker, and she is the founder of Functional Nutrition Alliance and host and producer of the award-winning 15-Minute Matrix podcast. She's leading a movement to transform the health industry into a system that works, empowering patients and practitioners alike with the systems and the tools of functional nutrition. So to find out more about Andrea and her work, you can head over to her website, which is andreanakayama.com, and you can follow her on Instagram at handle Andrea Nakayama. And now let's jump into this episode. Hey folks, just a quick reminder that all of the information presented in this podcast is for information purposes only. No medical advice, no diagnosing, no treatments suggested here. Before you try anything that you hear about or learn about here, make sure that you check with your medical provider. Welcome, Andrea Nakayama. It is such a pleasure to meet you and such a pleasure to have you on the show today.
Thank you, Natalie. I'm excited to be with you.
Yeah, this is, I was just listening to, actually just this morning, listening to another interview you did with a fellow Canadian, Jen Pike.
Yes.
From last fall. It was such a beautiful conversation because both of you, the way that you speak is just it's very informative. It's very soothing. It's very approachable. I could have listened to it all day long just because of the tonality. So nice it was a nice conversation. So, but I think that, to introduce you to the audience, I mean, there's so much about what you talk about that is it's so relevant and it's so important, I think, in a space where, whether we're in the longevity space or the biohacking space, that is that, we very often are looking to the outside for answers to the challenges that we face. And we're going to talk about that. But there's also this power of turning inwards and accessing our own resources in a different way, maybe changing our story or narrative, which I think is a word that you use quite a lot these days, to influence our outcome. But maybe before we start that conversation, let's start a little bit about talking about how you came into the space in the first place, because you have a very powerful story yourself
Yeah.
about what brought you to this work.
Yeah, thank you, Natalie, for that just reflection in what you're talking about. And my journey here came through a family health crisis, like happens for many of us in this space where we're caring for others.
Mm-hmm.
And for me, that was in April of 2000 when my late husband was diagnosed with a very aggressive brain tumor called a glioblastoma multiforme, the most aggressive type of brain cancer that you can
Mm-hmm.
have. At the time, I was 7 weeks pregnant with our first and only child. So we were actually telling people that we had a brain tumor to contend with before we were even telling them we were pregnant, because we were waiting to that
'Cause it was so
12-week mark. Yeah. So
Yeah.
it was this duality of life and of a prognosis that was just 6 months. He was given 6 months to live. So he wasn't expected to see our son born. Back in those days, April of 2000 again, most people who received that diagnosis were older. And so the diagnosis and the prognosis were also related to age, which we can talk a little bit about. But if you're diagnosed with cancer when you're younger, depending on the cancer, your outcomes are going to be better. So he sort of became the poster child for different clinical trials because he was in a young, healthy, otherwise healthy body. He lived 2.5 years, so he did live to see our son born, went through many treatments. There was a lot we had to do to support his body through treatments in order to make sure that he was doing as best as he could do. And there was a lot I had to do to support my body that was already in the stressful situation of pregnancy and then going through this very dire situation with my soulmate, right? So Isamu's diagnosis and prognosis, again, 6 months to live. He lived 2.5 years. That became my boot camp for realizing a lot of the gaps in medicine, in addition to a lot of the things we can do besides what we're looking, as you said, outside of ourselves in order to receive care, and also just understanding more about the connections between what we eat, what we put in our body, how we live, how we think, and our outcomes. So I think of that time as my boot camp. I was not in the field. I worked in book publishing. I had a very high level book publishing job. It took years after Isamu died for me to put myself back through a lot of years of school, because my undergraduate was a Bachelor of Fine Arts. So I didn't have the sciences. I went through many years of school, many programs, many learnings, and also felt there was something really missing in the education that I was receiving that I wanted to ultimately offer. And so that's my journey to starting the Functional Nutrition Alliance, and it goes on from there. But that's where I train other providers and what I felt like I wasn't getting.
So let's talk about those gaps. Let's talk about, because, you would have gone through not a conventional medical training,
Correct.
right? So, which I think is really interesting, because I think that people would think, oh, well, if you're training in alternative fields, then all those gaps should be plugged. And I think that, and particularly in functional medicine, I think that we assume that it's going to be a massive departure from conventional medicine. And in many ways it is. And yet in so many ways, maybe it's not so much. So maybe you want to just talk about that a little bit.
Yeah, that's a great question. So the initial gaps I was seeing were that medicine treated a person like their diagnosis. So that's gap number one. In addition to that, every person with the diagnosis is treated the same. So there's two gaps that I immediately was like, wait a minute, because this was the first time with Isamu's illness that we were really thrust into the medical system. We had been to doctors for a broken arm or a sinus infection, but we were now in the system. And Isamu had that moment where they did a CT scan and then left the port in his arm because they wanted to be able to access blood whenever they could. And he said, when are you going to take that out? And they said, oh, we'll leave it in. And that was his instance, his note of like, oh, I am now theirs. They have access to me in a way that we had never experienced. You know, at this point, he's a 31-year-old man, right? So he had never experienced anything like that. And that was a really significant moment for him. So those were the initial gaps that I was seeing in conventional care. We don't treat people like the person they are. We treat them like their diagnosis, and we treat every person with the diagnosis the same way. It's X for Y. It's a protocol-based system. You have X, we do Y. As I moved on and went through my training and learned more and started practicing and seeing thousands of clients on my own that were sick and not getting better, I was realizing some other gaps. And at this point, I was closely aligned with the functional medicine model, but was altering functional medicine into the realm of functional nutrition, which we can talk about. But I was seeing people who are seeing the top functional medicine docs and realizing where there were gaps there. So there were gaps in knowledge. They were talking to people in ways that didn't make sense for their own life or understanding. So they were still not agents in their own care. They were giving that agency away. But there were also gaps in the bioindividuality, surprisingly, because in functional medicine, one of the primary tenets is that we really honor the individuality of the patient, but dietary change was still a handout. Here's the handout. I don't care if you've had a history with a disordered eating, or you have body issues, or you can't digest certain things. You have X condition. Here's the handout with the diet that you should do. And here I was going deeper into the understanding of what's the pacing for making change. Why are we making change? What are we looking for from that change? How are we tracking that change? And do you understand, and can you make this change, which are important parts of making any dietary or lifestyle modification. It's not a prescription. It's lifestyle, which means it is in your everyday, and all of your stuff is coming up as you make change. So being able to honor what I call the story, the soup, and the skill really brought us into a broader realm of how we think about healthcare, and get rid of this this X for Y thinking is not, for me, part of the equation.
Yeah, I think it's that's just so powerful, and it applies not just in illness,
Correct,
but it applies in health. And you can see it also in a population that gets older.
Yes.
And that is still told the same thing. Or I see it with my parents, who are, you know, remarkably vibrant 80-something-year-olds, and they're treated like they're going to die.
Yes.
They're not treated, their doctors don't necessarily look at them to say, okay, how do we give you more energy? How do we make you feel better? How do we optimize anything? It's more like, how do we treat the symptom and see you later? Like my dad in his 70s had an abdominal hernia. He was a super healthy, super fit guy, but the doctors wouldn't operate on him because they said, well, the odds of complications of this surgery in a 70-year-old are too high. So to this day, he now has a bulging gut, and his back is a problem. Because he has no bracing. But it was because it's exactly what you said. They looked at him and didn't look at him. Right. They looked at a piece of paper that said male, 72 years old, and abdominal hernia, and risk factor, blah. And no, you're out.
Yeah.
And we're not going to do that.
Yeah, I think it's so interesting. I mean, there's a couple of things that come to mind, and I don't want to lose them. One is, you know, as we age, we do have more insults that have occurred to our body over time. We've lived a longer life. And so there is some truth to it, but how are we mitigating those insults throughout our life? So we're not just doing it at the place where we start to worry about longevity, which is our age when we see our parents in their 80s and we're like, wait a minute, I'm next. Like now I need to think about longevity, right? How do we actually mitigate those insults as we go along? And, you know, my dad died about 8 years ago now. And in the last 3 years, my mom has had a companion that was very different than my dad. And they had a very beautiful companionship. And that partner of my mom's just died last week. And her going through the process with him, of course, it brought up everything she had gone through with my dad. So it was like the echo of what was and what is. But also she would say to me, we go into the doctor and they treat us like we're in kindergarten. This is a Stanford educated engineer they're talking to. He understands what they're saying, but they're treating us like we're children. And that doesn't feel good. That doesn't actually help the situation. So I think that we not only treat people like their diagnosis, but we treat them like their age. We have a lot of bias that we bring to the equation in medicine. When it comes to this X for Y thinking that we're talking about, I just want to be a bit of a challenger here to all our listeners, because all the biohacking we're doing, all the at-home testing we're doing, I'm not saying it's wrong or bad, but in many ways it is buying into that X for Y approach. You do this test, it says X, you do Y. That is not the appropriate thing. There was a time years ago when the health summits were all the rage, and people were, me and all my colleagues were guests on all the health summits. And there was a point where there was a health a gathering of some of the top speakers. And I gave a talk on what I called the epigenetics of the online telesummit. I think you'll appreciate this, because I felt like my colleagues were giving advice and diagnoses, and the supplements for that diagnosis that then left listeners self-diagnosing and self-prescribing supplement regimes or dietary regimes that weren't necessarily appropriate for them, but are going to impact their long-term health because they don't understand the entirety of the context of what's being discussed. So I will never talk about supplements in a public way. I will always put things into context. But I think what you were saying just made me think of those different elements of how we are also treating ourselves in an X for Y. We're so desperate for the quick fix for whatever ails us or whatever we want, even if it's long-term health and longevity, that we grab and grasp and implement, and we don't know if it's right for us. So I just want to say, can we just take a pause? There's some simple things we are actually overlooking that impact those same things that you're after.
Yeah. Well, I will often say to people, until you've laid down the foundation, there's no way that any, let's call them supplements 2.0, right? Let's call them supplements 2.0, health tech 2.0, all the baubles and the toys and the tech and all the things that are out there.
The trackers and the
Absolutely. Well, the Aura Ring is a different one, only because I think it can give people feedback.
I love feedback loops. It's how we use the feedback loop.
Exactly. But I do think, but I'm right with you, where until we've laid that foundation, because you don't know what's going to fall into place from the foundation.
Exactly.
Right? Like you don't have clarity over whatever it is you're experiencing, whatever story you've built about what's wrong with you, how much of that might have to do with some kind of micronutrient deficiency because you don't eat certain things or you eat too many of another thing. Like I find this even with, and this might be a little tricky, but I wonder with a lot of mental health, we have so many mental health issues in the world right now. And, there's someone close to me who's in that system, full on, like in the system. And it's only after, I want to say 10 years, maybe, of being in the system that the topic of nutrition even came up. Right? Who knows how much nutritional deficiencies might be playing into so much of what's going on in the mental health which is not to, and I'm not diminishing mental health issues at
Totally.
all, because there's definitely a lot going on in that space.
Yes.
But at the same time, I don't think we're doing people a service
Right.
by giving them
There's
antidepressants.
definitely a wake up
For me.
happening. I mean, in my training, so I've trained, over 8,000 practitioners in over 68 countries at this point. And there's a definite uprising of mental health practitioners, addiction, psychology, social workers coming into the program because they're recognizing that there's a piece missing, which I just want to applaud. I think our understanding of the gut-brain connection and all the connections has evolved. When I think about things like, genomics, and I have a lot of different feelings about genomics, but the true use of
Let's talk about those. Because I think I'm with you on a couple of them.
In cancer genomics, which when Isamu was diagnosed in 2000, we have to remember the human genome wasn't even sequenced to the finalization until 2003. So cancer genomics was in its infancy. And nowadays, people wouldn't bat an eye in certain clinical situations about doing the sequencing of the cancer cells. It's not done everywhere. It's still evolving. But if asked, it's not quackery. Whereas when we tried to do it, because we were working with an advocate who knew what was coming, the pathology department thought we were insane, right? So things are evolving. That's over 20 years ago. Also, if we think about genomics and the good use of genomics, pharmacogenomics is also making a big shift, and this is impacting mental health significantly to bring it back to that realm, because we're able to see whether somebody genetically metabolizes a certain drug or not. And the mental health drugs and the cancer drugs are the two places where pharmacogenomics is really making some strides. It's not quite there with other medications.
It'll slow them.
Yeah. And the other thing, and you say one thing, Natalie, and I'm like, lots of things come to mind. But when we think about...
That's why I'm taking notes.
I know. I'm like, hold that. When we think about the basic things that you're talking about, like that foundation, a good example for me that I was just writing about in this article I'm about to publish on my personal website about omics is hydration. And I just want to anchor on a couple things. So first of all, I worked with a client in my case study group who suffered major fatigue. She had been to all the functional medicine doctors. She had stacks of labs that were like inches tall. They were trying to figure out what it was. She was doing all the things. She was taking all the supplements. She had all the specialty testing. I got her baseline serum labs. And my first question to her is, how much water do you drink? Because I could see in her red blood cell function that she was dehydrated. And it was like I had found her dirty little secret. She was like, why do you act like I'm so bad at hydrating? And so we had this conversation about the connection between the hydration and her iron levels and her red blood cells and that ability for her blood to flow and pump her brain and give her energy. Very busy woman in a very, city that has a lot of our people that you would think she would be getting help from. Hydration became a big change for her. And when you look at that and we think about our cells, so if we want to take it to the biological level, a lot of times when we're talking about longevity, we want to think about our DNA and we're thinking about cellular repair and people want to know about their mitochondria. Seriously, hydration is what your cells need more than any of the, curcumin. And I'm not saying those things aren't in the picture, but
but without water, nothing happens.
And people are skipping that realm in favor of all these things, which is very privileged as well. And I'm all about the democratization of functional nutrition. Like, this does not have to be shopping at Whole Foods and having buckets of supplements that you take every day. Not saying that I don't. do those things,
Yeah,
but
yeah,
I'm
yeah,
aware of the different degrees to which we can take on our agency in our health.
yeah, yeah. Well, and I mean, what you just said is so powerful. I think, and I've been bringing this up quite a lot in conversation lately, and more and more we're hearing about centenarians right now,
Yes.
and there seems to be a lot of people that are living to 100, and I would say that, with maybe a few exceptions, none of the centenarians that we're documenting today have been taking buckets of supplements,
Right.
have been, have been obsessing about their longevity,
Yes.
have been obsessing about how many steps did I take today. To your point, they, for whatever reason, adopted certain lifestyle habits as young people. They maybe were blessed with certain genetic profiles that also enabled their bodies to deal with whatever stresses and toxins they were exposed to. They've also lived through a century where toxins weren't
Correct.
as prevalent as they are
Yes.
today. But again, but they most likely were not obsessing over this. Now, I think that for our generations, if you will, who are really focused on longevity and health span,
Yes.
we also now are laying conditions down on our longevity. We're saying, oh, not only do I want to live a really long time, but I want to be hiking and traveling, and I don't want my feet to swell and look like sausages. And
When I
we have
look
all these
really
conditions.
good.
Yes, and I do not want to be looking like a raisin or anything like
Right.
like all of those things. But and I think what you just said though is that properly laid foundation. And I want to get into the mindset piece, because that is such a crucial piece of the equation here. Is so, without
Yeah.
it, nothing happens. And your hydration story, it hits home for me because my mom, who I adore, suffers from terrible cramps.
Mm-hmm.
She won't drink because she said, well, if I drink, I have to go to the bathroom all
Right.
the time.
And that's usually the
And
reason. Yep.
right? So I was visiting them not too long ago, and she had these horrible leg
Mm-hmm.
cramps in the night. She barely slept. It was too, and I've sent her all the
Yes.
supplements and the this and the that. And then I'm like, but are you drinking? And she goes, well, I drink water in the morning when I take my supplements. I'm like, that's not drinking.
You're like, here's more supplements.
Oh
You need
God.
to take them at lunch and at dinner. Just to get her to hydrate.
Yeah, that doesn't work either. She'll only take the morning ones. Anyway,
Oh,
just to drive home that point.
yes.
But
Yes.
anyway, so to carry on the foundation, but and I don't know if there's anywhere else you want to go from where we were talking, but I do want to move at some point inside,
Yeah.
about what's happening within. And actually something else that you just said, about the testing, about even the genetic testing.
Yes.
One of the most powerful things I learned when I was taking some of the genomic testing courses I took was that on paper, about 70% of the population are undermethylators.
Yeah.
But if you talk to the person, they don't show up as an
Correct.
undermethylator. And yet you have all these people running around in a state of panic,
Totally.
waving their
Yes.
genetic results around saying, I'm an undermethylator.
Correct.
I've got a terrible problem.
Yes.
And you're like, could we just take a breath for a
Yes,
second?
exactly. I always say that, our genomics, our SNPs, our single nucleotide polymorphisms, are not a diagnosis. We should not be treating them like they're a diagnosis. They're wallpaper. They're clues to what else is going on and might actually inform some of our decisions. But we don't know what is expressed, what's turned on, what's not. We just know that that's what's there. So even if you have an MTHFR or an mTOR or a COMP gene SNP, we don't know if that's been activated. In fact, the realm of polygenomic risk scoring, which takes into account the entirety of the sequence that we're seeing, is brand new. Barely anybody's doing it. And it helps us understand, well, if this is turned on, this one would turn that off. So like these things work together, but we as patients don't have that understanding at all. And most of these consumer-based testing companies don't have that understanding. So we're back to the X for the Y. I have an MTHFR. I need a methylated B vitamin. Well, do you know if it's expressed? And are there other markers that make that actually irrelevant in your situation? Like you said, they think they're an undermethylator, but that's just a piece of paper that's telling us something that's in a larger context. And I'm a huge contextualist. I'm looking again, the functional nutrition matrix, which is modeled after the functional medicine matrix, but has taken it into another area, looks at our story, our soup, and our skill. And when I say that, our story is everything from our antecedents or ancestry, our triggers, and our mediators, understanding those. Our soup are the things that are happening, our signs, our symptoms, our diagnoses. What are all those things that we can map and see that they're not isolated? And I'm going to come back to that in just a second. And our skill are these foundations that you're talking about. It's sleep and relaxation, exercise and movement, nutrition, hydration, stress and resilience, and relationships and networks. So understanding that those things all work together and we have to be able to see them together. So when somebody asks me, what would you do for somebody who has lupus? Or what do you do for somebody with hypothyroidism? I can pull out the matrix and say, you are looking at one little node on this entire picture. And if we only look at that node, we're missing the context that that exists in. Those signs, symptoms, and diagnoses are what I call branches. They're the expression of what's happening. We need to go to the roots. And I have a real issue with this notion of root cause resolution because there's never one root. And this is another problem that patients are chasing, that they're looking for the one root. And I'm looking at the soil that actually those roots live in. And I've created a model that helps us to see that soil. And, you know, mindset is a piece of that. I am not a mindset coach, but I am looking at the way in which the entirety of the ecosystem manifests in those signs, symptoms, and diagnoses. And when I talk about narrative, I'm actually looking at a different realm of narrative, because narrative can be the story that we tell ourselves. I really want to anchor on the story that got us here and recognize that, like, oh, wow, right. This happened and I felt like this then. And me, instead of why me, I have to change this marker's bad. I'm not supposed to feel guilt, whatever those things are that keep us in that sympathetic dominant chasing realm for a fix that blames all aspects of ourselves.
Yeah. Wow. All that. I want to stand up and cheer.
Yay!
No, I just
it's not sexy.
No, but you know,
though. It's not a sexy way to think about
but
health.
it is actually. It kind of is. You know, it kind of is, because to your point, the one symptom that is, or the one expression of whatever is coming up is we're seeing, the individual is seeing, or that they are coming to the doctor with saying, the practitioner saying, you know, this is the problem I need you to solve. And I would say that the most impressive people I've interviewed on this podcast, doctors and practitioners, are generally people that spend a lot of time peeling back the layers with their patients and or clients. And they recognize very often that in one sitting, they're lucky to get any story. And I don't mean story as in made up story. I mean, anything about the history of this person. I had one woman on the podcast who helps people with ALS. And she said sometimes she gets stuck. She goes back to her notes and she's like, you know, I will interview people for 2.5 hours and I will go back and all of a sudden I'm like, oh, that's it.
Exactly.
And she said, the one thing that she said that was really interesting, and I don't know what you think about this, is she said, the patient always knows. Like they know when things change. They know what event changed their course or shifted,
Yes.
but they can't always put their finger on it.
Yes. Yeah, I love that. And that really brings us back to the timeline that we use in clinical care. So what you're talking about in the clinic, I call, when I'm teaching practitioners, the art of the practice. Assess, recommend, and track. And that assessment time, like you're saying, is very deep. We're not giving recommendations when we're in the assessment phase. So this is also that mistake we were talking about earlier, where you're in a dinner party conversation and somebody's like, hey, I've got XYZ, and you tell them something to do, you have not done a proper assessment. And when we don't do proper assessments, when your clinicians don't do proper assessments, they are not honoring the therapeutic partnership that includes two experts in the room. There is the practitioner's expertise, but only you as a patient have expertise in you. And you need to be asked the right questions to illuminate that expertise. And it's exactly what you're talking about, Natalie. So when we're talking about a timeline, I also like to remind people, patients and practitioners, to do what I call micro timelining. So micro timelining may be taking a symptom and tracing it back. So if I had in my case study group a woman in her late 70s who said, I've always had problems sleeping. She's now dealing with a CPAP and dealing with I've always had problems sleeping. And I say to her, tell me the first time you remember having trouble sleeping. What comes to me as a clinician and to her in the recognition of a story of being in her girlhood bedroom, and the placement of the window in her girlhood bedroom being so close to the neighbor's house, there not being any drapes on the window. There was never anything nefarious that happened, but she didn't feel safe that somebody could look in the room. So she would never allow herself to get into that totally restful place. She trained her body to be in a kind of alert state because she didn't feel safe. And she would call for her parents and they'd come in and they'd comfort her, but she never made the connection. Here she is in her 70s dealing with sleep issues. And it's only the question of she's saying, I've always had sleep issues. Tell me the first time you recall that. She actually sent me a photograph of her house, where the room was, wrote a story about it. And that to me is where the patient does know something. So they might not know what the diagnosis is or why it's occurring, but they know something and they have an expertise in their lived life that for the right practitioner gives us clues, and for the right patient helps them to understand, oh, there's more to this than the solution or resolution that I'm seeking that's singular.
Yeah, that's such a powerful story. I mean, it's so amazing, right?
Yeah.
Because in a conventional world, it's sleeping pills, and even in a functional world, it's supplements, and it's it's and breathing exercise. And not that the breath work doesn't help.
Correct.
But if 70, let's say she's 70 years old, it was started when she was 10, 60 years of trained hypervigilance at night doesn't go away because you box breathe. Like it just, or at least not until you've recognized. And had an aha moment.
Exactly. And then still there's a lot of reset of 60 years of that training of hypervigilance. And then when she told me that story and I reflected to her, like, what, like just a whoa, like, wow, good realization. She was like, come to think about it. That's how I feel in the passenger seat of a car when I have anxiety. I don't have control over the situation. And so she was able to put some pieces together just from being asked a question that is that micro timelining. So I always like to remind people of the power of when was the first time you felt that, and bring me through that
Mm-hmm.
journey. If it's hormone issues, when was the first time you experienced hormonal issues? Well, my first period was, or I don't remember that, but when, and we start to uncover what
Mm-hmm.
else was happening in your life, what was going on. And I guess what I want to say here is that I know this can be frustrating for patients who are dealing with chronic health issues to hear, because we just want the fix. And I get it. I get that we just want the fix. And if you are struggling, you have issues that have not been resolved, if there was one fix, you would have found it. It would have been given to you. The internet is filled with information. We have so many things available to us. The amount of information we have available to us today is increasing, but the amount of people who are sick and not getting better is also increasing. So we have to shift our way of approaching the way we're looking at our health. And my request is make it broader, not narrower. Where do we think more broadly about who we are? How do we listen to our bodies and their stories? Get out of our head of what's wrong with us, but get into the actual narrative of our lived life, and that close listening that we as practitioners should do with our clients and patients. But I would love to help patients do that for themselves. Close listen with your body.
For sure. Well, and it will help them to help practitioners to help them.
1,000%.
Which is a ridiculous statement. But,
exactly.
But, it's this whole help me to help you thing. They become much more powerful advocates for themselves.
1,000%.
When they, if, someone listening to this who's been struggling, and it doesn't matter what, whether, and especially like with things like Lyme and chronic mold or cell danger response or MCAS, like all of these topics these days that have gotten so huge, right? And we talk about infections that have been reawakened in the body for whatever reason, which fundamentally is an immune system that's gone down for whatever reason. And it could be stress. It could be, and it could be exposure to another thing.
Yeah.
Right?
I mean, we live in forest fire arenas. That's going to be a trigger for sure for a lot of these dormant immune issues. And I think what you're saying is so important in terms of the therapeutic partnership. And when I say the term therapeutic partnership, that's one of the primary tenets of a functional practice, of functional medicine. And I think we've lost it because we've moved into the X for Y, the protocol thinking again. And so we've lost the fact that when you walk into that room as a patient, you should be working with somebody who wants your partnership. I also want to say we're putting too much pressure on our doctors. We're expecting them to know things that are out of their scope. And so when somebody has Lyme disease or MCAS or is dealing with mold and they go to their primary care, or even when somebody has suspected Hashimoto's and they go to their doctor and the doctor won't order the full thyroid panel, doctors are not going to order what they don't know how to interpret. They are doing tests for diagnostic purposes. And so our understanding that they're not trying to gaslight you in that moment. There are many instances of gaslighting in medicine, but
to be fair.
But doctors stay in their scope. And if they don't know what to do with a lab marker, they're not going to order it for you. That doesn't mean they're a bad doctor or that you have to be frustrated. Use your medical team for what they're capable of and continue to show up with more of what you know to be true. And one of the simplest tips I like to give patients is to know the difference between a sign and a symptom when they're talking to a conventional medical doctor. So something that you feel that they can't measure and something that they can measure. Your symptoms cannot be measured. Your fatigue, your headache, your dizziness, like they can't measure that. And so we need to separate how we talk to them, because we're talking to them about all the things at once and they're having like, what do I do? I don't know about that. If you are unconscious, they can still measure your signs. And so them understanding
Yeah.
your signs gives them something to work with. And then you layer on your symptoms. And that is the difference in how we just start to speak their language and be better partners, going back to what you said, because that's how we get more from them. First of all, understand what they do and where their scope is and what they're not going to do, and just accept that. It doesn't mean you don't continue to look or that you don't seek other help. Nobody's going to be
Yeah.
your be all end all. I call it pill protocol and practitioner shopping. People think if I can just see that doctor, then everything will be better. There's still a huge part you play in that equation.
Yeah. Yeah. No, that's very powerful. And, I do think understanding and scope is the perfect word, because it's, you don't want to put it down as limitations. It's just people know what they know.
Yes.
Some doctors have moved into other spheres. Others have not.
Yeah.
They've been perfectly happy in the scope of practice that they came out of med school
Yes.
with. So I think that puts the onus back on
Yes.
us as patients or clients to understand who we're dealing with. And I have a primary care physician here who I know can only do so
Yeah.
much for me. And then I have a functionally minded practitioner who I go to for the other
Yes.
stuff.
And in between, you do the
And it's
things for
okay.
yourself. Like in between,
Yeah,
you're
it's okay.
honoring your foundation.
Exactly. I mean, it's still a world of someone who's speaking from privilege,
Yes, of
right?
course.
Because at the end of the day, I have the resources, I have the education, I have the
Yes.
knowledge, I have the connections,
Yes.
all of those things. So I'm very grateful for that. But this is where I think, going back to those foundations that you talk about, you can do so much with the foundations, and you can execute foundations out of a no frills store. It
Definitely.
may not be super perfect, but it's certainly going to be better than
1,000%.
not.
1,000%. I mean, my non-negotiable trifecta is sleep, poop, and blood sugar balance. And so when I'm talking about sleep, there's ways to think about it that aren't about like, here's the problem. It's actually doing that assessment. How do I understand? What do I mean when I say I have issues with sleep? What does that mean to me? Am
Yeah.
I falling asleep? Am I going to sleep? Like, how do we start with the foundations there as opposed to jumping to CBD gummies and melatonin, right? Like, how do we make sure the foundations are in place? Poop is our best diagnostic tool. And I don't mean doing a stool test. I mean, just look in the toilet, pay attention.
Are you pooping?
Yeah. Are you pooping? Is it
Yeah.
different in quality? We do food, mood, poop journaling. If people are able, and we're not looking at it in a diagnostic fashion, we're just looking for associations. And then blood sugar balance, I do not mean you have to wear a CGM. Again, not that I'm against them, but there's a lot we can do just by implementing practices like fat, fiber, and protein. And if you don't know what fat, what fiber, what protein, that's where we start. We've skipped that.
Yeah.
And then people are vilifying the foods based on the CGM results, not understanding that there's a whole other context. There's stress, there's lack of sleep, there's all these other things that could be impacting that marker that we're reading and basing our decisions on, oh, when I ate XYZ, I had an elevation. Well, how long was it since you last ate? And what else was happening that day? And how was sleep last night? There's so many factors, and we've become so reductionistic that there's so much vilification of our foods, of grains, of like, there's so much craziness around dietary factors. Or people then are so fed up with it that they're just like, forget it. I'm not doing
Give me a
anything.
Snickers bar.
Yeah, forget it. Like, none of that worked. It didn't do
Yeah.
anything. I got obsessed. That is not health. And that is not longevity. To go back to your earlier point of the centurions that we're seeing, they were not doing these practices that had them obsessing over every move. They were living a life that wasn't even about choices. It was likely about realities that they lived in, that they embraced and honored, and it had ancestral roots. And like you said, it wasn't as toxic. So we're looking to hack something that is actually within our easier reach.
Yeah. Moving into it with a bit more ease, I think,
That's health.
maybe it will drop your stress levels a little bit, which in and of itself can be super helpful.
Exactly.
So let's talk a little bit more about this whole functional nutrition space and how you see it. Because I think it's really interesting, right? I think people might hear functional nutrition, go, "Oh, here we go. She's going to tell me not to eat this, that, and the other thing." And I think that, again, you're coming at it from a true space of personalization,
Yes.
which people use this personalized medicine moniker rather freely.
Yes.
And I see some of the big shops, like the big expensive pay to play shops, using that moniker, and I'm not necessarily seeing that the outcome is exactly what they're pitching.
Yeah.
So
yeah. I mean, for me, the primary tenets of functional medicine in its initial permutation, which was back in the 1990s with Dr. Jeff Bland and the real understanding of the impact of systems biology, that's where I anchor my understanding of functional nutrition. So the three primary tenets of a truly functional practice are a therapeutic partnership, like we were talking about, looking for the roots. And I'm not going to say there's one root. I have three in my model of the roots and the branches for any chronic condition, and a systems-based approach. And that's both systems biology and systems thinking, where we can see more of a complex picture as opposed to a linear picture. That comes right from the Institute for Functional Medicine's website. When I started in this space, there wasn't as much of an awareness of functional. And what functional has become now is a bunch of functional testing, which is not what really is about that space and what it was originally intended to be. So for me, functional nutrition is a practice that's the yes and. I'm not saying we don't need those doctors. I'm saying that patients are lost in the weeds and doctors are always at the tip of the iceberg. Even if they respect dietary and lifestyle modification, they do not know how to implement it. Even functional medicine doctors, in their medical training, they got 17 hours of nutrition training in their tens of thousands of hours of training. And if they learned a little more, it's still a handout. It's still a belief, a bias, a way of working. And so as a functional nutrition counselor, the people I train, they're either adding it to a practice or they're starting a practice. They might be coming from a medical background or a nursing background or mental health background or massage therapy, also health coaches, estheticians. It's sort of like, how do we all change the way we do healthcare because we recognize that there's something missing? And then it's a big reframe or a mindset shift because we all are conditioned to look for the quick fix. And so there's a lot of training that brings us into the systems thinking, the critical thinking that patients deserve. So for me, functional nutrition is based on those tenets. I have three systems that we're always anchoring back to, and understanding systems biology, so how the body should work, is the foundation of our ability to do clinical assessment. So oftentimes people will ask me, is this evidence-based? And I've just written a whole article on evidence. There's a lot of problems with evidence because of who's funding evidence and what actually is evidence and has time for evidence. The evidence in what I'm teaching is science, it's physiology. So when we understand how the body should function, where the connections are, then we can see more clearly. When you're telling me your story, I can think in 3D and see like, oh, wait a minute. When I use the matrix and understand that soup, the ingredients aren't just your thyroid. Wait a minute. I know how this connects to the gut and how that connects to your immune system and how this connects to your oxidative stress. That allows me that understanding of physiology and how everything is connected is what makes a difference in functional nutrition. In my work over in my personal website, I'm taking that understanding back to the patient. So not getting too deep into the physiology, but combining that approach of how we take self-care in a different way in combination with understanding the trajectory that brought us here and making room for ourselves, that true personalization, because we're forgetting personalization. That's where science is moving. Science is moving towards personalization. We've abandoned personalization. We do personalization with our bra sizes, our jeans, our bed softness, our Spotify accounts. When it comes to health, we're like, whatever, I've got X. What's the protocol?
Mm-hmm. Yeah. What's the protocol? And no. Oh, yes. Yes. Because of the space I'm in, I often get asked, what's the X for?
Correct.
Why? Yeah. And my patent response is it depends.
That's my joke to my students.
And
they'll
I'm sure
ask a
people's
question.
eyes roll
Totally.
right back.
Yeah.
Yeah. I'm sure people's eyes roll right back into their heads. I'm like, I can't give you more than that right now. Like, it's not, it's, and people are genuine in their quest.
Correct.
for the answers.
Yes. And that's what I want to honor when I said, like, I want to honor the patient who's on that quest, and it's frustrating and I get it. Mm-hmm. And sometimes we have to put it down in order to think about it in a different way. We have to stop that linear quest. There's a story I want to tell you about the first time I think I was actually touching functional medicine without knowing it. And it goes back to when I was trying to get pregnant. So this is, in 2000, 1999, 2000. Yeah. And, it was taking some time. We were 9 months in. I was frustrated that we weren't getting pregnant. We were trying to get pregnant. And I read Tony Wexler's book, Taking Charge of Your Fertility, which, at the time was the only resource that really talked about what's going on in terms of the inside of the body with ovulation and fertility and how we can family plan based on what is going on in our body. So now there's a lot of apps, and there's some, poor data hacking in relation to those apps with fertility. But back in the day, I made like a Google sheet, an Excel spreadsheet, printed it out, had it on my bathroom wall with a pen hanging from it. And I was clocking my temperature and understanding month by month what was happening with my cycle, and therefore what were my most fertile times. Was I fertile? Could an egg implant? All of that was part of my learning. And I was thinking, why are we not taught that? Like, why was I never taught this understanding at all? I knew like my menstrual cycle. I didn't understand the differences of my cycle. None of that was known to me. It's much more popular now, but that level of detail to be able to say, this is my fertile time, this is the time that we try, led to me getting pregnant. And I look back on that and I think, oh, my understanding of physiology helped me to help myself. I was practicing functional medicine then, and it wasn't about getting a blood test for this. It wasn't about any of that. It was just being able to say, the cycles look right, the time periods look right, here's the window, let's give it a try.
Yeah. Well, I mean, as a starting point,
exactly.
Right? Like as a starting point, you would have hoped, and we hope today with all the tools that are out there, that even a GP who's caring for a young woman who's trying to get pregnant is going to introduce her to these ideas so she can self-guide herself. Because unfortunately, what ends up happening after a year or two, well, I guess you're going to have to go for IVF. Although I would hope there's more testing that involves even at that point, right? Like we want to test the man, we want to totally. There's a battery of information, but yeah, that is fascinating because 20 years ago, honestly, isn't that long, right? At least not when you're my age. Yes, it's not that long ago. You would like to think that should have been at least common knowledge for your doctor to share with you and say, hey, why don't you do this?
Yes.
Let's try this for a few months and let's see what happens.
Yes. And let's face it, the internet wasn't what it is now.
It wasn't what it is today. No, but it's interesting to your point. There's no shortage of information, but what we now what we need even more now than information is a curation of that
Yes.
information. And I think that's where the doctors and the coaches come in. And something that you said earlier that really landed with me is that the functional medicine doctor is not, and frankly, it's not in their scope
correct.
to coach the patient. And the best ones out there now have teams that work with them. So they do the doctor part, and then they'll have a coach, a nutrition coach, or whatever the case may be, to help them to implement.
Correct.
Because, you know, it's interesting. When I became a nutritionist, it took me about a year to figure out telling people what to do doesn't actually help them in the least. It really doesn't. They need help in how.
Right.
It's not the what. I mean, the what too.
The what and the why. The why and
the what and the why is great. And for some people, the why is enough to they go. But for many people, it's the how and helping them to get out of their own way.
Exactly. I call it the what, why, who, how, and now. Like all parts of the equation need to be there. Yeah. And I think the challenge that a lot of people in the nutrition space have is that they're trying to play doctor. They're trying to use tests. They're trying to diagnose. And I've never been, confused about my scope. I've always been the yes and. Like, wait a minute, there's a gap. I got to fill the gap. This is a medical issue. Make sure we get a diagnosis or we do this. But I find, especially the more students I train, they want to play doctor. And so I had to create an entire part of my curriculum, a whole booklet and a training on scope. Because I'm like, why are they confused? I was never confused. It doesn't mean I don't look at labs. It means I'm doing something different with those labs. I'm looking at them in a totally different context. It is not in my scope to diagnose. As my mom would say, I'm smarter at diagnoses than her doctors are, but like not my scope, that's not my game to play. And so really people understanding that there are gaps and that we need people who fill those gaps instead of expecting everything from one practitioner.
I love that. I love that. And I do think it's rampant. Right. Yeah. I think that if you're a practitioner that is not a doctor and you can read labs and you can encourage your client to maybe ask different questions or encourage their doctor to look in different directions, maybe, in that sense. But there is a lot of, lines getting blurred. I think right now.
And I think some of those lines are with the kind of testing, the genomic testing, like we were talking about. There's hormone testing, there's GI testing. Like, I think we don't understand what those tests are actually meant to do. We're using them as diagnostic tools. Those are not diagnostic tools. A Dutch test isn't going to tell you what the protocol is. From my scope of practice, it doesn't tell me treatment. It tells me about your physiological function. I'm looking at relationships between hormones. I'm looking at metabolization of hormones. So I'm bringing my scope to that test. And it's not my job to be in the prescribing role, but I might advise you after we've done some work where you might be able to explore that. But then a conventional doc is going to dismiss that kind of testing. And I think in our bubble of space of biohacking and functional medicine, we think that these tests are giving us some kind of evidence, but that evidence isn't the kind of evidence that your conventional doctors want or use. They're not diagnostic tools. They're clues. That's it. That's it.
Yeah. Well, and I think when it comes to hormones, blood rules as a first step.
And blood, looking at hormones for me is out of my scope. Like once I see blood, I'm like, I don't know what to do with that. But if you give me another kind of test, I can see because I can see the inner workings. So again, for medical doctors, blood rules for hormones for sure.
Yeah. But finding that medical doctor that's willing to have a foot, at least have the fence open.
Totally.
that says, this is what the blood said. Oh, that test is really interesting. Let's look at what that says overlaid with this. And now we have power. Now we have, to your point, we have a much fuller picture. We're still missing parts, but we still have a fuller picture. Okay. Well, Wow. I feel like we could keep talking for a really long time. And what time is it? I said we weren't going to go for an hour and a half. It's getting close. So, well, no, not
Yeah,
really.
we're okay.
It's an hour.
Yeah.
So, all right. Well, Andrea, what stone have we not turned over that you would love to turn over for the audience today?
Yeah.
Before we get to that critical point where we're like, okay, we got to go.
I know. And we do got to go. Right. So I thank you for the really brilliant dialogue. I think that it's a really great opportunity for listeners to be able to hear two practitioners talking and thinking through things from a different lens. So I feel like that's a gift, hopefully, too. But it was a gift for me. I hope it's a gift for our listeners.
Thank you. It's a gift for me. I'm all in. So hopefully everybody else enjoys it.
So I want to talk a little bit about narrative medicine because I think it's even a newer field and an emerging field. And on my personal website, AndreaNakayama.com, I'm merging the two worlds of functional nutrition and narrative medicine. And they're two worlds that don't know a lot about each other. So I feel like I'm kind of pioneering this integration, if you will. And for me, that narrative medicine piece is about the story part of the equation. And it's about understanding that deep listening that we were talking about. Currently, the practice of narrative medicine is a pedagogical practice. It's very academic. It's only about 20 years old, and it's a practice for teaching other providers. It's for teaching doctors how to be better listeners, to touch the humanities through the arts. So it might be poetry or writing or an actual piece of art or music, and being with the humanities as a way to exercise the muscle to listen more clearly to what the patient is saying for the kind of clues that you and I have been talking about. Ironically, the biggest part of my work is talking to practitioners. But what I'm trying to do is see how we take that practice and transform it to the idea of how we listen to ourselves. Is the practice of sitting with a poem, of being in an opportunity to reflect for 5 minutes on a quote or something else that you're interacting with in the humanities, does that give us an opportunity to touch a part of ourselves that wakes up those cells that bring back memory that helps us to understand ourselves? So I don't know. I'm in a testing phase of, is this possible? Okay. Does anyone care? But I think there's a lot of potential in the practice and what it does for practitioners and what it can do for us as patients. And it also invites not just the deep listening, but the slowing down that I'm really trying to invite so that we can gather more information about ourselves before we rush to all the solutions. So I just wanted to touch on the narrative medicine piece because I feel really passionate about it right now. It's really helped me understand the difference between qualitative and quantitative information. Our healthcare is very anchored on the quantitative information, the tests, the measures, and we've lost that qualitative information. So for me, it's this merging of the two pieces, and there's a Venn there, there's an overlap there that I think can be really brilliant in self-health care.
Wow. That's so by using art and poem and
music,
basically the humanities, as you said, music, all of those things. So really what you're saying, I mean, I don't know what you're really saying, but is it
what am I
somehow,
saying?
I don't really, I'm trying to imagine what it looks like, but there's something about what you're saying, this act of slowing down and listening, which I think we've all met. I mean, maybe we haven't all met, but I've certainly met certain practitioners or medical doctors who innately have this built in. And I feel like this is a quality that is not necessarily nurtured in med school.
Exactly.
By the system. Yes. So for someone who doesn't, if somebody comes out of med school, they're still curious and they're still have that ability. Man, they're rock stars, right?
Exactly.
Like they're exceptional human beings. There's a bunch of people who may have gone in with some of it and have had it beaten out of them. And then you have the rest of the population who are book smart. and don't have access to this right now.
Exactly. And in my coursework at Columbia University, which is where I'm studying narrative medicine, the other people in my cohorts are all doctors, nurses, palliative care, doctors who have had chronic health issues themselves. They've come to the edges of where the human part, the humanities, right? That's why when we interact with the humanities, something that comes from a deeper part of human expression, it reminds us of the human that we are treating in the academic, clinical realm. I'm offering at this point free workshops, a few times a year. I'm trying to get it to every month at my personal website where patients can come in. And the last one we did, we took a poem. I read the poem aloud. I asked a volunteer to read the poem, and then we listened to the poet read the poem, a video. And, the emotion that comes from people when we interact with the humanities, something that's coming from human expression, base human expression, not about health. And that touch point wakes something up in us that makes us human again. And I am so concerned that we've forgotten our humanity in our quest for whatever we're seeking, whether it's the fix or longevity. We're so hyper fixated on the quantitative information that we've lost the quality of what matters. I mean, I'll end with saying, I've been going to dance class. I used to dance and I haven't danced in years. And I was like, I'm going back to dance class. And I found this very inclusive dance studio. It's packed, 60 people, all different shapes, sizes, colors, ages. And it is so joyful. The choreography is hard enough that it takes me out of my head. All my issues go aside. It's very embodied and there was a new person in class. I hadn't seen him before, and he was standing behind me and he was just cracking up yesterday. And that's how I feel. I come out of there with joy, so much joy. And that is equally a part of my longevity, of my healthcare, as the omega-3s I'm taking in the morning or the green tea that I'm sipping right here. And we forget that there's this part of health that is living. And so I just want to bring us back to, yes, all the things. I get it. And
I love that.
Joy, laughter. Those are also non-negotiables, as are sleep, poop, and blood sugar balance.
I freaking love that. I have said so often that in our culture, we forget to dance. We don't dance. Young people dance, but once you're past a certain age, we don't go dancing.
God, come visit.
We don't,
it
and
is
that
so
physical
much
expression.
fun.
I would love to, but I do wonder in the narrative medicine if you will find, or if you've already found, that some people will be moved and connect to spoken word. Some people will be moved and connect to visual arts. Other people may be moved and connect to movement.
It takes
dancing.
A little bit of,
not everybody's going
totally. Absolutely. And it takes the reason with that example that I gave with the poem is that it really takes people through the journey. In that example, hearing the young man read about his deaf sister and listening was people are crying. They're in tears because you can't not be in his performance of his spoken word. And so taking people through the journey of, she just read me a poem. I don't like poetry. I find myself reading poetry every day. I'm like, what is going on? I've never read poetry every day.
Who am I?
But there's something there that's touching and waking something up in me that allows me to be a better practitioner and even a better patient for myself. And I want to bring that forward with all my clinical understanding. And this is my mantra: everything is connected. We are all unique and all things matter. And that relates to the field of omics and science, the field of precision medicine, and the field of epigenetics, which I know you're so passionate about. So science is telling us things. Healthcare is much more narrow.
Yeah. Yeah, I love it. I love it. I love the, oh my God, this is so good.
Okay.
All right. So if you do nothing else, folks, go dancing.
Dance,
Sing, listen to
drink some
music,
water.
whatever.
Yeah.
And for the love of all that is holy, please drink water. Even if it means you have to go to the bathroom. Think of it as your motivation to get out of your chair every hour. Andrea, this has been a total treat. Thank you so much. Please tell people where they can find you and find out more about your work and access your programs and all the things.
Thank you. I feel like I have a new best friend. Everybody can go to andreanakayama.com. That will lead you back to the Functional Nutrition Alliance, which is the company I founded, the training there, my podcast there, which I'm not producing right now, but there's a lot of great episodes. All sorts of things lead you back there. And the writing and the workshops that I talked about will be there as well. So Andrea Nakayama, all the places will inform
all
you.
the things. Yeah. It is the soil where the roots live.
Exactly.
Thank you so much.
Thank you.
This has been great.